This is inverted vitrectomy. Challenging vitrectomy for taut and contracting epiretinal membrane, restoring the normal anatomy. These are the preoperative OCTs from the patient. There was a pretty thick epiretinal membrane attached centrally, distorting the overall retina structure. The patient is aphakic and had a previous vitrectomy for an extensive retinal detachment. Some vitrectomy was completed to get rid of possible floating RPE cells from the previous surgery. An air fluid exchange was performed then so as to stain the internal limiting membrane ILM. Brilliant blue was then injected at the macular area. A pinch and shave technique was carried out so as to find an edge of the epiretinal membrane. It is possible to see that the staining of the ILM had created a contrast with the lack of staining of the epiretinal tissue, thus helping in the action of peeling the epiretinal tissue. The epiretinal tissue was finally found and could be grasped and lifted away from the retina in an unblocked fashion, freeing up the macular area of epiretinal tissue. Another air fluid exchange was carried out. Endolaser was performed as a preventative method to keep the retina attached. You may see the postoperative retinal pictures and OCTs and compare the OCTs with the preoperative ones. The foveal shape and depression reappeared, giving the macula back its close to normal shape. We appreciate your attention.